Good afternoon, I'm Bea Dallas, and my colleagues Kristen Hagaman, Jessica Lovins, and Emily Quiza will be talking to you today about respiratory therapists. Before we started our research, we decided to interview a respiratory therapist. Ty Zellner was kind enough to interview with us. She's the head of respiratory therapist at Upson Regional Medical Center in Thomaston, Georgia. There are two pathways to becoming a respiratory therapist. You can complete 2 years of an associate's degree or 4 years of a baccalaureate degree. After graduation, you can take the CRT exam to become a licensed CRT. CRTs are considered an entry-level therapist. In order to further your education, a CRT can opt to take the clinical simulation examination to become an RRT. RRTs are considered to have a more advanced level of skills and expertise and generally receive a higher salary for a higher level of training.
So while respiratory therapists can remain CRTs and RRTs, there are certain fields that they can go into that may require experience or more certification, and I'm going to touch on a few here. So the first one that an RT can work in is long-term care. These therapists work in skilled nursing facilities, subacute care centers, rehab hospitals, and other types of long-term care facilities. With a wide range of patients from different ages, so they have pediatrics going into geriatrics. So in this field, you generally need to work in a hospital setting first and have either your CRT or RRT. And with an RRT, you actually have a greater chance of going into a managerial position when pursuing a long-term care profession. They can also go into neonatal pediatrics. With neonatal respiratory care involves is treating and monitoring newborns for breathing disorders, while pediatric respiratory therapists work with toddlers and older children providing breathing treatments and other care for children with asthma, cystic fibrosis, and a wide range of other respiratory problems. Neonatal pediatric therapists generally hold their CRT and or RRT credentials, and many also have the neonatal pediatric specialist certification, also known as NPS, or Asthma Educator Certified Certification, which is AEC. Surface and air transport respiratory therapists have the important job of keeping patients that are in transport to the hospital from emergency situations in ambulances and helicopters alive while working with nurses, physicians, and EMTs. These respiratory therapists generally have their CRT or RRT, while some also have their NPS to help with pediatric transports. Most also have one or more life support credentials as well. Pulmonary rehab respiratory therapists help patients with chronic lung diseases like asthma, emphysema, chronic bronchitis, and pulmonary fibrosis cope with their conditions through education, treatment, and exercise. Many work in pulmonary rehabilitation centers, and they just generally have their CRT or RRT. Polysomnography respiratory therapists are therapists who work in sleep, and they're generally employed by sleep laboratories, and they're generally stuck with the night shift when your sleep studies are normally conducted. Respiratory therapists in this field generally hold a CRT and or RRT credential, but they also may want to earn the Registered Polysomnographic Technologist credential, also known as RPSGT, which is awarded to those who take a specialty exam in polysomnography. Education respiratory therapists serve as the professors and instructors in school programs, including those at the community college and university levels, and they may also work as continuing education coordinators for hospital respiratory therapist departments. Most respiratory therapist educators enter the specialty after having worked as an RT in a hospital or other setting, and nearly all will have earned the advanced level of RRT credential and some form of higher education diploma. Critical care respiratory therapists are therapists that like the faster pace of the ICU, and they've often earned the advanced RRT credential. Home care respiratory therapists, it's kind of self-explanatory. They're going into people's homes, and they have experience working in a hospital or other healthcare setting, and they're generally holding their CRT or RRT without further specialization. And finally, pulmonary diagnostics. So pulmonary diagnostic respiratory therapists work in hospital or physician office-based pulmonary function laboratories where they conduct the testing required to help physicians determine whether a person has a lung disease, and if so, which one. These therapists generally hold their CRT and or RRT along with the specialty credentials in pulmonary diagnostics.
Alright guys, so now we're going to talk a little bit about licensure requirements for respiratory therapy. So they're really similar to our requirements in that they vary state by state as far as the number of contact hours required and how often renewal is required. So in Georgia, if you're an RT, your license must be renewed every 2 years, and you will have to get 30 CEUs per cycle in Georgia. So remember that 1 CEU corresponds to 10 contact hours. So that's going to be 50 to 60 minutes in contact with a patient in a class, generally hands-on training, although there are some online options as well. In Georgia, respiratory therapists also have direct access. So that happened through the Medicare Act of 2013. So they are going to be able to take patients off the street if it's patients that have chronic issues. So that's kind of cool. Now, this is just a cool image that explores the fact that a lot of times when people think of respiratory therapy, they think of like chronic conditions, acute care, but there are some situations where you can provide emergency care to people. So, heart attacks, drowning, or shock. An RT might be able to do that as well. So these are some typical skills and knowledge that you're going to see an RT do on a daily basis. So they can diagnose lung and breathing disorders, recommend treatments. They're going to take a look at tissue and blood specimens and determine levels of oxygen. So if you're working with someone who had a condition that might limit their uptake of oxygen, that would be something that the RT would monitor. They're going to help people who are on ventilators and who have artificial airways manage those. They will educate people about lung disease, that's extremely relevant to their field. And they can conduct chest exams to determine the best intervention, depending on what they're dealing with. So, and we are going to come in contact with RTs. Mostly you're going to see it in the acute care setting, but as you can imagine, when we're working with these patients who have more complex medical conditions, we're definitely going to be interacting with them, so it's important to be aware. So Kristen is going to talk to you guys more about current issues in the profession.
So we asked our respiratory therapist if she interacted with physical therapists, and she said that she did. She works in an inpatient hospital setting, which is where the majority of respiratory therapists work. However, they can work in other settings, including nursing homes. So if a physical therapist works in an inpatient or in a nursing home, they will likely have frequent interactions with respiratory therapists. I found one article written by a physical therapist that said, should a PT specialize in inpatient trauma and an RT specialize in ventilator care, they might rely on each other extensively during the care of the patient. So in some settings, PTs work closely with RTs. The RT that we interviewed said that while physical therapists are working with patients, the respiratory therapist assists in mobilizing patients to tolerate activities with the minimum amount of exertion and monitoring oxygen exacerbation. I included this funny e-card that says before you yell at a respiratory therapist, consider that you may in the future yell for a respiratory therapist. I include this because it's important to remember that as PTs we will be working with a variety of healthcare professionals, including respiratory therapists, especially in inpatient setting. And each of these healthcare providers are important for patient care, so we need to be respectful and work cohesively to benefit the patient. So the current issue in the field of respiratory therapists that Tyne mentioned was that there are not enough respiratory therapists for the current demand. There are currently over 100,000 jobs for respiratory therapists, but there is a 19% projected growth for the career from now until 2022, leading to 22,000 new jobs. Tyne gave us the impression that many hospitals were understaffed in respiratory therapy, and as our population continues to age, there will be an increased incidence of respiratory conditions such as COPD and pneumonia, which will increase our demand for respiratory therapists. So in conclusion, just to wrap up kind of what we've told you already, respiratory therapists must obtain education from an accredited institution and pass the CRT exam in order to gain licensure and potentially continue education to become an RRT. Respiratory therapists can specialize in various domains and specialty fields, Georgia respiratory therapists have been recently granted direct access and are continuing to grow as professionals. Currently, there's not enough respiratory therapists and the demand for more is high, and they play an important role and are an essential aspect of the healthcare team. And these are our resources, and we thank you for watching our presentation.